So thank you everyone for joining this physics session. This is a WebEx session put together by London Southbank University and Rebecca Johnson, and virtual, and it is titled Teaching with VERT Physics. I'm just going to introduce Rebecca to you all. She is the course director for the bachelor level therapeutic radiography, as well as being the course director for therapy radiography at diploma level. So she's a busy person, so we're really privileged to have her time this afternoon to be able to deliver this session. Rebecca's been a really strong user of VERT. She's used it for a number of years now, and she's really good. So we're really good, really pleased to have her doing this session. So hopefully we'll all learn a lot. So what I'm going to do is pass over to Rebecca. She's going to run through her presentation, which includes overview of her sessions, and these sessions are using the QA plate, the alignment phantom, and the plotting tank. There's some really interesting slides in there with some student feedback, and also at the end we'll have time for some questions, so hopefully you can all stay on the line for that. I'm just going to assign control over to Rebecca now and leave it in her capable hands.
Thank you very much. That is perfect. Excellent. So welcome everyone. This afternoon for me, this morning I believe for some of you. So as Tom quite clearly said there, we're just going to have a bit of an overview of history here at VERT, thinking about the consideration of simulation within the field of radiography, how we embedded VERT physics into our curriculum, feedback from our students in regards to the use of VERT physics, and looking at the summative examination results associated with those radiation science modules, and then also looking at some conclusion and key points looking forwards as well. So I think we can all acknowledge that simulation has been quite a wide use within the field of radiography, and certainly within pre-registration health student studies now for many years. I think traditionally we've always used simulation in manual handling, movement and handling, resus, and we can use it obviously when we're talking about immobilization techniques, and then obviously VERT and anatomy TV. We can now utilize IT models, which allow us to use simulation in many different fields, as well as obviously our radiotherapy treatment planning, so that we can obviously link that up, our systems DICOM linked with our VERT, to enable us to do the academic teaching. But I think we've always found there was a bit of a gap, especially when it came to radiation science and the teaching of radiation physics. And we have really found that VERT physics has really helped us to bridge that gap in education and simulation as well. So here at London Southbank University, VERT was installed back in 2009. And that was after the National Radiotherapy Advisory Group wrote a report to the UK government back in 2007, identifying that there was a potential crisis in England in relation to radiotherapy education and training, and that there was an urgent need to reduce the attrition rate of student therapy radiographers. So the report itself included a recommendation to introduce hybrid virtual environment skills training facilities across 10 education providers and 51 associated radiotherapy and oncology sites, which provide both clinical training and experience. And that's probably when I first became involved in VERT itself. I was actually a practice educator out in clinical placement prior to coming here into education, and that is when I first started working with VERT itself. But here at Southbank, led by Noreen Sinclair and Dr. Adele Stewart-Lord, LSBU had their VERT machine commissioned back in 2009. And then in 2013, just as I was joining the team, it's actually now been relocated to within the School of Health. I think this is quite a big advancement for us here at Southbank, because previously we had to share our treatment skills labs with other professions, with other, so the School of Engineering and other faculties, whereas now it's obviously allocated specifically to us. Then back in the autumn then of 2013, as our commissioning numbers for pre-registration students continued to increase across London, NHS London funded for VERT physics to actually be installed here at LSBU. And this was completed relatively quickly and was actually completed by March 2014, and that included all of our staff training as well. So then our VERT physics itself became utilised with the students within their curriculum from the academic year of 2014 into 15. Since then, we've also had Apple iPad installed, and as we go through, we can show you how the VERT physics has actually been developed and delivered both with Apple iPads and also previously without it. So, following a lot of research and evidence that was produced out by Nesbitt and Matthews back in 2011, we acknowledged that the learning resource that we had to provide for our students to enable them to utilise VERT physics really had to mean that we had to consider the theory of the knowledge that they also had, and making sure that we utilise this theory to underpin the design of the resource itself. Because we can acknowledge that our students currently had the formal teaching, so the teaching of the formal theory, and that's mainly based on explanation and description of the processes involved. However, in order for them to develop practitioner theory, which generally is based on judgment and understanding, we were always relying on our clinical departments in order to provide that environment and that education. However, we know that students' clinical practice is often quite opportunistic, and it does rely on the assumption that the participation in clinical activities will automatically stimulate learning and bridge the gap. However, I think we can all acknowledge that it doesn't necessarily mean that just because you're completing something, doing something in practice, it doesn't necessarily mean or involve that you're actually thinking about what you're doing. In fact, it is quite possible to learn how to do things without actually understanding the reasons for doing them. So I think we've often acknowledged in adult learning, and certainly in adult education theory, that it's really important for our students to realise why they're having to learn something and understand something, so that then when the learning opportunities come out, that they are then free to focus on the task that is set, that they can work collaboratively together with other students, and then that allows open dialogue and then hopefully deeper understanding to help entrench the learning that they've been experiencing. So we've kind of based our VERT physics worksheets on the fact that students should be able to build and use existing background knowledge so that they can build on what they already know. We also had to acknowledge that the activities needed to be aligned with the curriculum so that it would obviously enhance student learning, because this way it would ensure that we establish deep learning to avoid confusing students and creating an imbalance within the system. So therefore, since VERT physics tends to lend itself to both the clinical modules and our radiation science modules, our practical sessions have been embedded here. So we use VERT physics in both our second year BSc pre-registration programme and also in our first year pre-registration still postgraduate programme. And then as Tom was saying, we've got a couple of activities now that we'll just show through to you so that you can see some of the activities that we've been utilising. So the first one here is we've got our QA plate up present. We have our students go to multi-centres across London and South East of England. So we obviously don't have available to us all the different quality assurance equipment that they might use out there in placement. But we use VERT in order to ensure that they've got the foundations of knowledge and actually the theory that they've learned, that they can then utilise that within the clinical environment. So we always start with an overview of the QA system, showing how a QA plate is set up on a treatment couch, talking about the alignment, using lasers to align the plate into the correct position, and then talking about how we can utilise a front pointer to obviously confirm and ensure that the plate that we've set up is at 100 centimetres. So we have, during the development of these worksheets, we work closely with our clinical partners, relying on them to make available to us their quality assurance documents so that we could then be able to utilise those in the development of our worksheets. So you can see one of our worksheets here. It gives the students specific kind of instructions of what to click onto, what to go on next, so that then they don't get caught up in the technology and the software of physics, but can actually spend their time problem solving and answering questions as we go along. So you can see quite clearly throughout the worksheet they have specific questions that are asked to them, and then they have to problem solve and find out what the preset errors are inside the VERT system itself. So we can go through and click on the different slides, and then the same way that they would do in VERT themselves, we can obviously allow them to beam on so that then they can actually see in practice and visualize what would happen in the clinical environment compared to what we are actually simulating here for them in VERT physics themselves. So we can obviously change our field size, we can change the energies that we're using, and beam on for all the different positions to enable the students to check that the irradiated fluorescent beam is obviously matching the parameters of the quality assurance plate. And then if it wasn't, the students would have to problem solve what could potentially be wrong. These students will have already had the theoretical training, or teaching, should I say, in regards to how a linear accelerator works and the components of a linear accelerator. So they are actually in a position to be able to hopefully problem solve some of the areas that actually come up on the QA plate itself. I don't know what that noise was, it wasn't me. So we then can utilise the alignment phantom, and we use the alignment phantom for the second part of the QA plate discussion itself. If we just scroll down through here. And the alignment phantom activity is very useful to ensure that students understand the importance of the integrity of setup utilising lasers. And we can also use it to ensure they know how to correctly calculate separations and what potentially could be wrong in regards to setup errors that could be produced if we don't actually have our lasers aligning properly. It also goes through teaching them about the processes of isocenter shifts and ensuring that students are aware how close and how important it actually is that our isocenter shifts obviously match our treatment parameters, our machine parameters that we see in the clinical environment. So once again, the first few slides take the students through setting up the alignment phantom, and then they can verify the actual setup. We make them double check the separation of the phantom, and then to have a quick discussion around the principles of isocentric setups. We can then put on some errors for the students so that they can calculate and visualize what a laser alignment would look like in the actual treatment room itself. And we do that in all the different planes. When we're utilizing this plane here, obviously it opens up for the discussion of couch drift and the problems that we can have when we rotate our couch through either 90 or through 270 degrees, and the impact that can have on patient setup and the importance of verification of patients and their positioning as well. So it's quite useful because it is quite twofold in making students understand the physics behind the reasons as to why we do quality assurance and the practical skills of how to complete that. But it also then pulls them into the treatment area of actually understanding the verification and the importance of verification, and understanding some of the errors, not only setup errors, but potentially, quality assurance errors or setup errors that could occur, which would obviously impact on patient setup as well. And here we can see what happens when our couch isn't properly aligned. And once again, it's referring the students back to the actual movements on the machine itself, actually demonstrating an understanding of some further errors that happen. So that's one of the first VERT physics ones that they actually complete. So we're just going to swap this one round. The other VERT, sorry, let me just select that. So the other VERT, one that we actually utilize, is obviously using the the plotting tank itself. And we use the plotting tank after the students have received their theoretical teaching on percentage depth dose, so that they can get a real understanding prior to obviously going into radiotherapy treatment planning of percentage depth dose and output of a linear accelerator from this point of view. So we will probably have to close that one and reopen up Google Chrome. Excellent.
I think if you close down the other
Have I got
version of
two VERTs running?
Yeah, that's right.
Is it not liking it?
And then close down Google Chrome and then try again.
Try again. See if it likes this. No, it still thinks it's on.
Yeah, if we close down that version of VERT, or you can,
Oh, there we go.
And then try again.
Now see if it's happening.
Do you want to bear with me? I'll
Reconnect me.
Yeah.
Thank you.
Sorted. 1 second. Can you just assign control back to me a second there, Rebecca? If you go to the top of the screen, it's not letting me do it. If you go up to the green part of the drop-down menu of the WebEx at the top.
Mine isn't green.
Sorry, I've got it there.
Okay.
1 second. Okay. Bear with me a second, and we'll just close that down and try again. There we go.
Perfect.
Sorry about that.
That's okay, thank you.
There you go. You're back in control.
Lovely. So when we're...
Oh, right.
No, you haven't given me full control. It's trying to get me to draw on things.
Okay, try that.
Okay, yes, that's perfect. Thank you. So when we're looking at percentage depth days, once again, we're actually getting the students to calculate these for themselves. So they have quite specific step-by-step instructions of comparing and contrasting all the different options that are in there. So we use it so that they can look at the differences in 6 MV and in 15 MV. And we also use it to establish what happens when we change the field sizes, when we change the SSD, so that then the students can actually calculate the impact that these have on the dose distribution and percentage depth dose itself. It also has some linking to their core textbooks, and so that then they can really help draw out that link between the theory and the practice. So the students themselves are given instructions of how to open up the control tanks and then the different parameters they need to set. It also allows them to visualize what would actually be happening in a clinical environment, so they can see in which dimension the actual readings are being taken from. So here we've got a 6 MV and 15 MV chart coming up. So we utilise it so that they understand entrance doses, talking about Dmax, talking about exit doses, and then we can lead the discussion on as to why a patient would potentially be treated with 6 MV or as to why they would be potentially treated with 15 MV as well. We then, as I said, spend some time changing the parameters so that we're looking at differences and changing in field size and energy and SSD, so they can get a really good understanding then of percentage depth dose itself. Then VERT physics is very useful because it can also allow us to look across the treatment beams themselves. So then we can get the students to sample so that then we're getting a reading going across the beam. And this really teaches students the importance of beam homogeneity. So as I already acknowledged, they've already had the theoretical teaching about how a radiotherapy beam is produced, so how a photon beam is produced. They've learned about flattening filters and the concepts such as this. And then this really teaches them all about areas of penumbra, talking about the areas of umbra, as well as obviously looking at lateral horns that we see in dose distribution as well. It also really starts getting them to clearly make the link between this part and radiotherapy delivery in regards to dose distribution and starting to build on some of the concepts that they will be needing as they develop into potentially final year students going forward. So they complete both of these sessions now in small seminar groups. So there'll be between 6 and 8 students in a group, and currently they are facilitated still by a member of staff. And that's because of, as today's example has shown, that sometimes it will have been the first time that a lot of these students have utilised the software that is VERT physics, so that to prevent them from getting caught up in the technology side, we make sure that an academic's there to help them problem solve, and if they get lost or confused, to put them back on the correct path themselves. So we will, Tom, could you just please call up the previous...
if you bring up the QA plate on this one, I just load in the QA plate and it'll be the virtual presenter.
Okay, that's fine. I will find that. Oh, clicked on the wrong thing, excuse me.
Easy done. Yeah, and then it'll just be your virtual presenter and it'll be
hiding in there, hopefully.
And then just press open and it'll be there. There you go.
Excellent. Thank you. Perfect. So in regards to the student feedback that we've received, so in total for the first year between the academic year of 2014 and 2015, a total of 12 postgraduate diploma students, so these are still pre-registration students, and 29 BSc and DipHE students were taught using VERT physics during either their first or their second semester. So the feedback that we gathered came through the university module evaluation questionnaires, and they identified that 100% of students acknowledged that they could establish clear professional links throughout the module. Over 3/4 of the students acknowledged VERT specifically within their written comments, with all of these requesting more VERT sessions. And some of the comments you can obviously read up on your screen there. And I think they're very important comments to acknowledge, because we didn't specifically go to the students to ask them, how did you find VERT physics? Did you enjoy VERT physics? From that point of view, all of these comments actually were coming from them as an acknowledgement of the sessions that they've enjoyed and how they really felt it enhanced their learning. From our point of view as academics, our first-time pass rate for our second-year BSc students increased to 94%. And for a first-time pass rate, that's pretty outstanding. These modules were previously highlighted as potential at-risk modules, with sometimes in previous years we had fail rates or first-time fail rates at around 40%. So to go from our pass rate up to 94 with only 6% failing that particular year, to previous years where we've had almost half the cohort fail, we can certainly see the added benefits that VERT physics has brought to our actual students' ability to pass their summative assessments. In regards to our PG DIPs, so our first year pre-registration students, after the utilisation of VERT physics, their first-time pass rate increased to 100%. So absolutely brilliant results from that point of view. Hopefully they've got their summative assessments now coming up in 3 or 4 weeks' time. So hopefully we will once again see these results being replicated through. So having a look then in some of the conclusions and the key points, as we've developed we've now run VERT physics for 2 consecutive years, so our data from 2014-15 showed a really big improvement in our pass rates. This certainly continued for our BSc students, and as I say, I'm hoping that it will also continue in our PG DIP students as they've got their assessments coming up. We can also see that come 2015, we've actually embedded the use of the Apple iPad in use for our VERT physics sessions. And let's say that then the students don't have to have dual screens and having both the web local host up on the same screen as the actual VERT physics, and they can actually now use the Apple iPad in order to manage and navigate their way through the worksheets as well. We've acknowledged that it's really important to ensure that the students understand directly how these practical physics sessions relate to their radiotherapy practice, because then that greater level of understanding really helps them bridge the gap between the theoretical teaching and then obviously clinical placement as well. We've always acknowledged that smaller practical seminar sessions are ideal. They do like to work in small groups where they can then learn off each other and also spend some time problem solving with each other. We've also had a variety of different students from different placements in the same teaching session, so that then they can actually learn how things have been doing in different clinical departments as well. We've always ensured that for physics that staff have always been available for the discussion of any complex ideas and problem-solving direction. This is quite unusual for us here at London Southbank, because when we use VERT traditionally, it's always really been for anatomy and problem solving around anatomy and techniques. And we have generally left the students to complete those discussions by themselves, peer assess and also self-assess their progression. But we have always acknowledged how sometimes physics can be quite a sticky subject, so we've always currently made sure that they have had a clinical or an academic member of staff to support them through these teaching sessions. And then we must also acknowledge our collaboration with clinical partners. I was talking about initially when we were developing these workbooks that actually I wouldn't have been able to do that without speaking to our clinical partners, because they were the ones that were providing us with up-to-date work instructions in regards to their quality procedures out there in the clinical environment, to ensure that actually the workbooks that we were developing are obviously reflective of current practice. So I think that's quite a sound overview of what we've been getting up to recently. Has anyone got any questions for me?
That's great. I'm just going to jump in there. Thanks very much for that,
Thank
Rebecca.
you.
Really excellent overview there of how you're really successfully using the physics at the moment at London Southbank. I'm just going to, again, try and take control there and turn everyone's microphone back up. Are you, let's see, that's great. So let me just, sorry, just a little minute where we pass back over. Are you,
Yeah, you should have it.
there we go, I think. Okay, brilliant. So I'm just going to turn everyone's volume back on, so we should all be there. So yeah, feel free to jump in, anyone with any questions for Rebecca that you want to speak about. I have a message here from Carol that actually says that the physics module is a really great help with these kind of concepts, and I agree. It really helps visually to understand these things. And Carol, I know, uses this for her students with physics training, and she said that her students also comment quite similarly to yours. So it's good to have that feedback, really. So I wanted to ask actually, Rebecca, if that's okay. So just to get this right, the sessions with the alignment phantom and QA plate, you would deliver that as a teaching session yourself, is that right?
No, well, I think we generally start with an introduction to VERT physics so that they know how to open the modules and what different modules are available to them. And then it's only the first couple of slides where we're showing them, you know, the principles of QA plate setup. And then afterwards, it's the power's just handed back over to them so that they can problem solve through and see, the errors that are coming up. I must admit that the fact that, you know, our QA plate glows, as it were, works really well for students, because obviously we don't actually see that in the clinical department. And so that because they can actually see a fluorescent beam, it does then allow them to marry up some of the problems with the parameters and being able to, kind of hopefully make some educated guesses as to what could be wrong.
Yeah, right. So it's really interesting that you give the students the power almost to be able to teach themselves whilst you facilitate in the room. It's a really interesting concept. Obviously it works really well.
Yeah, otherwise I just have to listen to my own voice all the time.
We have a message from Yella who joined, I think, halfway through that, or just at the start. Yella's from in Holland, in Amsterdam, and he's just asked, what is the size of the group during the session with the QA plate?
So there'll be between 6 and 8 of them. So currently we've got 12 PG dips and 30 BScs. So that generally means that we run these sessions 8 times in a semester.
Wow, okay.
So then they're allowed, well, generally about 45 minutes for the QA plate session, and then we sometimes find that the percentage depth days can take up to an hour.
Great.
But we also run them very early in the morning, so getting into London is very expensive if you travel in early. And sometimes, in order to encourage that engagement, we will always run our VERT sessions either at the very beginning or the very end of the day, so that then students can attend their normal academic scheduled teaching, and these are additional sessions on top of those.
I see. Is there any more questions from anybody?
Hi, Rebecca.
Hiya.
I'm Jelle Schudde from London University.
Pleased to meet you.
Hi. Can I ask you about, you said something about peer assessment and self-assessment on the VERT physics module?
Yes.
Can you explain a little bit more in detail what you do with peer assessment?
Yeah, so on the workbooks themselves.
Do you want control again? So you can,
yeah, or you can just call one up. I don't mind, Tom. Either's fine. So
I'll let you drive.
thanks. So as you can see on these sessions themselves, they've got questions in regards to what do you notice, what do you think might be wrong, so they can problem solve through those, and especially here when they're looking at calculating separation. So here, the first year that we did this, they obviously had a lecturer in with them, and the lecturer would provide that feedback kind of for them to make sure that they were on the correct line. Nowadays we have like a Moodle quiz that runs alongside it, so that then they can decide as a class what they think their answer will be, and then they can go onto Moodle, which is linked within their platform, and it's kind of like a multiple choice. So they can choose what they think will be wrong, or the correct answer, and it will actually start scoring them and rating them. So it's quite useful in regards to assessment, because they can either do it personally, so one person can do it for themselves, or quite often we encourage them to do one potentially for themselves, but also one for their group that they're actually completing their seminar with, because then I can get 6 groups, different results up, and then we can obviously compare them against each other. And that's quite a useful tool, because it stops them from just making random guesses, because we kind of negative mark. So if they just start choosing anything just because, rather than thinking about potentially the understanding and the principles behind, it will mean that they'll end up scoring lower than their friends.
Okay, excellent. And are you using the results of the Moodle session? Do you use it during a lecture, a feedback lecture on the subject?
No, we don't tend to follow up with a feedback session. We leave that to be quite directed from the students themselves.
Yes. Okay, excellent. Thank you.
Brilliant. Thanks,
Okay.
Yella. Any other questions from any of the people on the presentation here? No? Okay. So I think then, if there's no more questions, we can call that meeting to an end and say thank you very much to Rebecca for the excellent presentation and for sharing her experiences with VERT and with VERT Physics.
Thank you.
Thank
It's
you,
been a
Rebecca.
pleasure.
Thank you, Rebecca.
Great stuff. So I'm going to stop that recording there.